Welcome back to Healthy Lifestyle with Saira. The topic of our today's video is potential causes of shoulder and arm pain. Shoulder pain is very common because our shoulders are the most mobile joints in our body. Problem with the rotator cuff are the most common causes of right shoulder and arm pain. Many of these issues are also the cause of left shoulder pain. In this video, we will discuss the potential causes of shoulder and arm pain. There are possible causes of pain that occur in your shoulder, arm, and even in your hands. Number one is rotator cuff disease. The rotator cuff is a group of muscles and tendons that keep your upper arm bone in the shoulder socket. Tissues of the rotator cuff can become diseased due to overuse or injury and can lead to tendinitis, where the tendons of the rotator cuff become irritated and inflamed. Bursitis, in which the bursa, a fluid filled sac that helps your rotator cuff to move freely, becomes inflamed. Impingement, where a part of your shoulder blade called the acromion rubs against the tissues of the rotator cuff, leading to swelling and pain. Torn rotator cuff. This happens when one or more of the tendons in your rotator cuff tear. Tears can be partial or complete. They may happen due to an injury but are often due to wear and tear that happens over time. Shoulder dislocation. A shoulder dislocation happens when the top of your humerus pops out of its socket in your shoulder. This occurs often due to sport injuries, car accidents, and falls. Broken collarbone. A broken collarbone happens when there is a break in your collarbone. Your collarbone serves as a connection between your shoulder and breastbone. Many breaks happen due to falls or car accidents. Upper arm fracture. This occurs when there is a break in your humerus. Breaks typically happen close to your shoulder or along the middle of the bone. Like broken collarbone, they often happen due to fall or car accidents. Frozen shoulder. A frozen shoulder is when your shoulder stiffens and becomes painful without a known cause. The condition often eases gradually on its own. Calcific tendinitis. Calcific tendinitis is a condition where calcium deposits build up in or around your rotator cuff, causing symptoms similar to those of a frozen shoulder. The exact cause is unknown. Shoulder sprain. A shoulder sprain happens when ligament in your shoulder are stretched or torn. This can happen to any of the ligaments of your shoulder. Sprains often occur due to sports injuries, falls, or accidents. Separated shoulder. A separated shoulder happens when there is an injury to the ligament that holds your shoulder to the collarbone. This can cause the ligaments to stretch or to completely tear. Shoulder osteoarthritis. Osteoarthritis is when the tissue of your joints become worn down, often due to normal wear and tear. Shoulder arthritis can have a significant impact on those who have it. Shoulder rheumatoid arthritis. Rheumatoid arthritis is a condition in which your immune system attacks your joints. People with rheumatoid arthritis can experience significantly impaired shoulder function about 1.5 years after the condition is onset. Cervical radiculopathy. Cervical radiculopathy happens when a nerve in your neck becomes compressed as it moves away from your spinal cord. It can happen due to wear and tear, herniated discs, or bone spurs. Brachial neuritis. Brachial neuritis is when the brachial nerve which supplies your shoulder and arm becomes inflamed. Its cause is unknown. About 60% of the time, brachial neuritis affects your dominant side. Brachial plexus injury. Your brachial plexus is a group of nerves that control movements in your arm and hand. This function can be affected when these nerves are damaged. Common causes are fall and accidents. Thoracic outlet syndrome. Thoracic outlet syndrome is a group of conditions that happen when the nerves and blood vessels around your collarbone and first rib become compressed. It can be caused by injury and repetitive motions. Home remedies to treat your shoulder and arm pain. If your shoulder and arm pain is mild to moderate, you can try the following things at home before making an appointment with your doctor. Use the RICE method. RICE method can be used shortly after an injury to ease symptoms and promote recovery. It includes stop doing any activities that cause further pain or irritation. Ice. Apply an ice pack or cool compress to the affected area for 15 to 20 minutes several times a day. Compression. Wrap or bandage the affected area to help alleviate swelling. Elevation. Try to elevate your right shoulder and arm about the level of your heart. Take over the counter medications. Several types of over the counter medications can help ease symptoms like pain and swelling. Some examples include acetaminophen and ibuprofen. Try some gentle stretches. Regular gentle stretches can help improve flexibility and range of motion. Maintain good posture. Poor posture can place further stress on the tissues of your shoulder and arm.